Hi, this is Doug.
And I'm Cindy.
Welcome to Help Me Help Mama 5cast. Thanks for joining in. Today we're going to talk about aging parent care options. What do we need to know about this?
Well, if your loved one is starting to decline and you're noticing this, there are things that you see that they may not be doing as well as they were doing 6 months ago, and it's got you concerned. I think step one is to do an assessment, to look at a general assessment and see the things that they can do and they can do well, things that they need help with. And if there's a specific area, you go to the specific assessment. I know a lot of our seniors these days have issues with cognitive impairment. So look at maybe that assessment and then determine what kind of care, assistance, or supervision your loved one needs. And that will help you go to the next step, which is to determine where can they live. Can they live at home? Can they live at home alone? These days we have so much technology. This morning we were on a Zoom call talking to people in different parts of Arkansas and Georgia and other states, and it's like, it amazes me, the technology. So the technology that you can use for your loved one to remain home is incredible.
And you were talking about assessments. There's two types we talk about in Caregiver Support Academy, our member site. One of them is a family assessment, which is this,
Right.
Really it's just the family members paying attention. What is mom struggling with that she could do well 6 months ago or 3 months ago? I mean, maybe you've seen a pretty marked change just recently. Maybe 6 months ago, she was driving to the grocery store, getting groceries, taking them home, putting them up in a cabinet, fixing her own meals. Now she can't do that. She needs assistance with that. At least somebody to get the groceries, bring them in, put them up. Maybe after that, she can cook the meal. Or maybe her meds. Maybe she's not taking meds.
Yeah, maybe she's not taking her medications, which is very important.
Oh, yeah. And then also medical assessment, obviously, her primary care physician or a specialist that deals with matters of the aging would need to assess mom or dad medically to see what they've got to say as to their functioning and maybe to make sure that their medications are right. So two totally different types of assessment, but together these should point the way that these are the things mom or dad needs help with, and maybe will help you make a better choice as to some of the care options where they should be. So we're going to quickly go through a few of these. Home alone, that's where most people want to be. Home is leave me at home, leave me alone, leave me at home, and they just want to be there.
Absolutely. It's where they've been for 40, 50, 60 years, and it's their comfort zone. It's something they're very familiar with and they can hang on to, but you need to be concerned. Is it safe for them? Is it safe for them? Can they still do that? So, and you may need to make that call, have that discussion with them because of your concerns.
And a lot of times you talk to, if dad's declining, you talk to mom, she may say, yeah, it's okay, I got it. And, maybe so, maybe no. So that's something you need to be very aware of.
That is a very good point, because mom and dad, as long as they've been together, they've come to lean on each other. So typically what we've seen is one has the physical ability to do things and the other has the cognitive ability. So they lean on each other and compensate for each other. But it gets to the point that they're doing that so much that can crumble. And it can really be devastating on the health of the well spouse. So,
another one is home with family assistance. If there's enough family around, they can chip in time and or money resources to help. And even if they are remote, we was talking to a remote caregiver earlier today. He lives several hundred miles from her mom, and she was doing a lot remotely to help her mom and dad. And because of her help, they're able to stay at home longer. And so there's local caregivers and remote caregivers.
Another option is in-home non-medical care, which is private, hired professional caregivers. In our area, $18.50 to $25 an hour. Next option is
Adult daycare or senior centers, in most areas of the country, there's senior centers that are usually absolutely free that mom or dad can go to during the day. Some of them even have buses that pick people up and they can socialize with other seniors. And adult daycare works just like, when you dropped your kids off when they were little to daycare on the way to work and picked them up on the way home. Same thing for mom and dad. Not right for everyone, but if they can still get out and they enjoy socialization, that may allow you to continue to work while making sure your mom or dad's got care during the day.
So the next step up is going to be independent living. It is great socialization. It's affordable. It may be good for your loved one. But if they need a little more care, the next step
is assisted living. And if they need help with maybe a couple of activities of daily living, they maybe can get around fairly well now, but they just need some help. Assisted living might be something good to look at. They normally provide meals and some provide laundry services, and maybe for an increased fee, they do even other things. So check out 2 or 3 assisted livings in your area if this is appropriate for your loved one.
The next level of care going up, requiring more care, is nursing home. Now, you need to do your research on the facilities again, but make sure that this is a level of care that they need, that they will skill for. You need to look at the best facility and how to pay for it.
The next, really not level, but service that's available is hospice. And hospice can be provided at virtually any of these places that we've been discussing. Mm-hmm. My mom received hospice care in her final months, and it was a great service. And, she received inpatient hospital care, which was at a freestanding hospice unit, but a lot of people receive hospice care at a nursing home or an assisted living or even at home.
At home.
And this is not full-time care. A hospice worker will come out a few times a week and sometimes more often if needed, and will make sure a person is comfortable receiving, that their meds are okay and that they're not in pain. So this is a primary focus of it at this point in time.
So if any of this is information that you need for your loved one and for you to help make a decision, then join us on Caregiver Support Academy.
Caregiver Support Academy is open just for a few days. If you're seeing this before the doors close, which is November the 10th at 5 o'clock Central Standard Time, join us. Go check it out at caregiversupportacademy.com. This is a virtual lifeline for caregivers. It's a membership group, and just for the next few hours, it's open. The doors are open for founding members, which means we're offering a ton of stuff inside Caregiver Support Academy at a very low founding member price. So check that out, caregiversupportacademy.com. Thank you for watching today. If you're not subscribed to this YouTube channel, please subscribe. If you liked it, please do so, and click the notification bell at the top so you can be notified when we do other videos. Thanks for watching and have a great week.
And thank you for being a caregiver for your loved one. You're making a huge difference in their life.